we've got our esteemed guest all the way from Nigeria, Sheikh Nuruddeen Lemu, who's the Director of Research and Training at the Dawah Institute of Nigeria Islamic Education Trust. He develops, facilitates, and conducts courses in enhancing interfaith dialogue and engagement, interfaith cooperation, responding to various forms of religious extremism amongst Muslims and promoting faith-based critical thinking, which is termed Sharia intelligence. And that's what he's going to be talking to us about today. He has lectured in over 30 countries. He holds a master's degree from the Edinburgh University in the UK. His personal motto is growth and contribution with compassion, wisdom, faith, and fun.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وأصحابه أجمعين السلام عليكم ورحمة الله وبركاته. This is a topic I would like to quickly rush through, but we must at least have some time to say thank you for this opportunity. It's been a wonderful time here, and I'd like to just stand on existing protocols to all my fathers and uncles and aunties, brothers and sisters in the audience. There's something the chairman said about the little story of the old man and his son when the tent was stolen. And he said, too much education can sometimes undermine common sense. In the subject area of Sharia, this is a very common thing. Someone said this morning, and he apologized for saying so, that it's as if to get a sensible person who graduates from a Darul Uloom is actually a blessing, that it is so rare, unfortunately. Sharia intelligence is about sense and sensibility when it comes to understanding the Islamic way of life and the guidance that Allah has given us. Abu Hamid al-Ghazali described the relationship between reason and revelation to be similar to the relationship between the eyes and light. That to say you're going to use reasoning without the guidance of revelation is like moving around with your eyes open but in the dark. And to say you're going to move around with revelation without the gift of reasoning is like moving around in broad daylight with your eyes shut, or like someone who is blind. And so both reason and revelation are gifts to guide us. Allah describes the Quran and the message He has sent in His ayat or lessons, both in creation and revelation, as being liqawmi yatafakkarun, for those who will think, liqawmi ya'qilun, for those who will reflect, li'ulul albab, for those who will use their minds or their brains. In fact, after the guidance of the Quran and the guidance through its implementation in the Sunnah of the Prophet ﷺ, scholars reflect on a verse of the Quran, and I'll come to that verse, where sometimes the clear text of the Quran says you should do something like amputate the hand of a thief. And yet, a distinguished Sahaba like Umar bin Khattab realizes that in a particular context, that injunction will not achieve its objectives. And so he suspends that punishment. You would ask, but how could he suspend the implementation of a clear text from the Creator? It is because the implementation of that clear text clearly contradicts the clear objectives of justice that the text prescribes. it's going to go with the letter and disrespect the clear spirit. This is what in Usulul Fiqh, the principles of Islamic jurisprudence, is called istihsan, equity. And Allah says in the Quran and praises alladhina yastami'una al-qawl, those who listen to what has been said, fayattabi'una ahsanahu, but they go with what they know is the best in it. Ulaika hadahumullah wa ulaika hum ulul albab. It is such people who go with what is best that are guided. They are the ones who are ulul albab, those who are using the gift of the lub, the gift of the brain. In the various fields of the Islamic sciences, in an attempt to get closer to understanding the will of Allah, scholars have studied various specializations, just as you have in medicine. Some are dentists, some are gynecologists, some are pediatricians, some are psychiatrists, different fields. And in Islamic sciences, we have the same thing. You have those scholars who have studied the Quran. They may not know a lot about hadith or anything about hadith, but they know the Quran, they understand the language, and they try to explain what they understand it means. Another set of scholars study what is called ulumul hadith. They study the sciences of hadith, the verification of the authenticity of hadith and how strong are certain hadith. Some are scholars of seerah. They try to study the biography, the context in which the hadith and the sunnah was operating. Some are scholars of fiqh, of jurisprudence. Others are scholars of qira'at and the science of tajweed and recitation. Some are scholars of usulul fiqh. They study the principles. They are like your industrial pharmacists. They are the ones who try to study the methodologies of coming up with rulings where the Quran and Sunnah may be ambiguous or silent. Some are scholars of qawaid, of the maxims of Islamic jurisprudence. These maxims are articulations of the spirit of Sharia. And some are scholars of maqasid Sharia, the objectives, the intent, the higher purpose for which Islamic legislation is meant to fulfill. And if you don't know and don't care about these specializations, the problems we have for health workers, for anybody else, is similar to people coming to hospital and taking a pregnancy case to a dentist. Just because somebody is called Maulana or Sheikh or Ustaz doesn't mean they are a jack of all trade and a master of all. Scholars have their specializations, but we usually do not identify these specializations, which would have made it clear what this scholar is good at and what he is not good at. And so it is important for you to really be critical. Who do you take your case to? Who do you listen to? And how much authority do you give a particular scholar? And to recognize your role in producing a fatwa or a religious verdict for a particular case. What's the best thing to do in the case of my particular patient? You yourself are a scholar. You're not a scholar of the text, or what they call the ulama of the nas. You're a scholar of waqi. You're a scholar of the reality. You're a scholar of the case at hand. You can't suspend your own reasoning, your own understanding, when a scholar of the text who doesn't understand the disease, doesn't understand the patient, is saying something. You have to realize that you have input in this. This is more important when you realize that what a scholar tries to do, even a scholar whose field is the subject of ijtihad, juristic reasoning, these are scholars who are well-versed in the sciences of the principles of Islamic jurisprudence. Usulul fiqh is the study of the equations of fiqh, how law is derived, How do you derive those equations? And which equations do you use for a particular case? Scholars of usulul fiqh study that. Fiqh is the result of usulul fiqh. So if usulul fiqh or the mujtahid is your industrial pharmacist who produces the medicine, the faqih is usually the chemist. He has a lot of prescriptions to give, but he is not necessarily a doctor. He has the books that have the various verdicts on different issues and the differences of opinions on various issues, but it is you who deals with the patient that will decide what is the best prescription to give. Even for scholars in usulul fiqh, they would look at the Quran, they would look at the Sunnah. And where the Quran and Sunnah are silent, they move to what are called the secondary sources of Sharia. They look at ijma or consensus and qiyas, reasoning by analogy. They look at the ra'ayi or the opinion of a sahaba. The Malikis would look at the amal or the practice of the people of Medina. But they will also look at public interest or maslaha. They'd look at equity, istihsan. They'd look at preclusions and ways of preventing things, a consequentialist type of thinking that's called saddu zariya. But because of the nature of many contemporary medical issues, these are cases that are usually not directly handled by the Quran or the Sunnah. Something as basic as organ transplant or blood transfusion didn't exist at the time of the Prophet, didn't exist until recently. So you don't have anything clear from the Quran on blood transfusion, for example. Somebody may want to argue, but blood is najas, blood is impure. The Quran is not directly clear on it. The Sunnah is silent also on this issue. There's no ijma or consensus of scholars or Sahaba. There's no amal of Medina on it. There's no urf or custom to base a fatwa on. So what would scholars do? Qiyas is weak in this area because the closest qiyas you would do would be to say that reasoning by analogy, which is qiyas, when it comes to organ transplant or transplant from a pig or another human being, well, would it be similar to eating flesh or drinking blood? And many scholars would say, no, you can't use that analogy. And so you are left with what are called maslaha, concern for public interest, concern for the best outcome of the individual patient, and concern for consequences. Because of that, even when you ask a mufti a question on many contemporary health issues, they're actually going to use their reasoning. It's not Quran, it's not Sunnah, it's not Qiyas, it's not Ijma. It's their assessment of what's in the best interest of the patient or the community. And the reason I'm emphasizing this is so that you realize that very often what the mufti has to do is actually use his God-given common sense, which very often you are actually better at. What is important here is the need to try and understand and read a little about this subject area. We will always need the scholars of the text. But it is important we appreciate that the subject of healthcare belongs to the field of mu'amalat, in the category of mu'amalat, which refers to interpersonal social affairs, worldly affairs, as opposed to the field of ibadah, which is tied to your relationship with your creator, prescribed acts of worship. In the area of mu'amalat and social affairs, a maxim rules the default assumption on issues. And the maxim is al-asl fil ashya al-ibaha, that the premise of things is permissibility. The default judgment on every medical issue is that everything is halal except what is haram, not the other way around. Not everything is haram except what is halal. No. Everything is halal as the default setting in Sharia on all issues to do with mu'amalat, except if there's evidence. And evidence has to be evidence from the divine, Quran, Sunnah, or you can show that it goes contrary to the values of justice or fairness that are divine qualities that we are taught. The field of medicine and healthcare is critical to the fulfillment of two major maqasid. Actually, all the maqasid. The maqasid refer to those higher intents of Islam. These maqasid are arrived at by scholars studying all the harams on issues, all the mustahab. You know, when the Quran says this is prohibited or the Sunnah says this is discouraged, scholars try to categorize what are these prohibitions trying to protect us from. And if something is fard, compulsory, or mustahab, encouraged, what is it trying to achieve and promote? And they conclude that Sharia is trying to promote 5 major issues. It's trying to promote deen and preserve deen, that people should always have a link with their creator, and life must always have a purpose that is guided by its creator. But that there's also, from the study of the Quran and the Sunnah, an objective called the hifdhul nafs, the preservation and the promotion of life. And this is where healthcare comes in, where diet comes in, and food security and many other things that will preserve and promote life. But there's also the hifdhul aql, the preservation and promotion of the human intellect. If the mind is not working, human beings don't become very responsible. And so there's the prohibition of narcotics and things that will mess up your thinking. If you're thinking, if you're insane, there's no sin against you. If you're too young to think in a mature way, there's no sin against you. If you do wrong while you are asleep, so long as your thinking is not operating, you are not considered responsible in Sharia. And so subjects surrounding psychology, stress management, psychiatry, these are critical to the maqasid of Sharia. And so we should not look at our roles in the healthcare sector as this is just my professional role and there's another aspect of my deen. These are fulfilling the maqasid of Sharia. These are deen. Deen is a way of life. Your job as a doctor or a nurse or any healthcare profession, this is part of how you fulfill your role in this dunya. And because it's a part of your deen, not a dunya issue, you should do it with ihsan and itqan, with excellence and professionalism, with the kind of excellence you'd like to do in your salat. Why? Because you will stand before Allah. How did you achieve this maqasid of healthcare and the preservation of it? One of the maxims in Islamic jurisprudence is that whatever is a prerequisite for an obligation is itself treated as an obligation. If the study of medicine is a prerequisite to being a doctor, and being a doctor is a fardu kifaya, it's a social or communal obligation, we must have people in that, then the study is also treated as a fardu kifaya. Fard means it's an obligation, and it's a sin to avoid it. There's a reward for doing it. To wrap up, when it comes to healthcare workers, people who come to you don't come because they don't have problems. It's not like somebody going just in a shop or somebody who's just going for a haircut. The situation of people in the subject of maqasid of Sharia is usually classified into 3. Some people, and inshallah we pray most of us belong to the category, who are interested more in their tahsiniyat, the luxuries of life, the desirables. But some people go into a more deeper level of need called haja. They are in need, they are not in comfort. And then a much deeper level of darura, necessity, life being threatened, serious insecurity. The rules of Sharia, when they say alcohol is haram, that applies to people who are in the tahsiniyat category. Everything is fine, then alcohol is haram. Everything is fine, so you don't expose your aura to another person. But for those in the medical profession, you have to study the rules that apply to people who are in haja and darura. In that situation, harams are classified or reclassified. Some are harams in and of themselves, they are haram of the ends. And some are haram of the means. And we will discuss some of this, inshallah, in the next topic when we use one example of treating members of the opposite sex or the other gender. Because scholars would say, when somebody is in darura, then nearly everything becomes halal. When life is threatened, you don't start asking whether the medicine contains alcohol, whether this particular dental thing contains some porcine or pork product. When life is threatened, a maxim of Sharia says, al-mashaqqa tajlibu at-taysir. Such difficulties call for the relaxation of laws. But very common, somebody is not coming with that life-threatening situation. They are coming with a situation that is haja. It's not tahsini, it's not darura, it's haja. But in a case of haja, the scholars of usul would tell you that in a person facing haja, those things that are haram of the means become permissible, whereas haram of the ends remain prohibited. Exposing your aura is not haram of the ends. Zina is the haram of the ends. Exposing your aura is a haram of the means because it is part of what leads to the haram of the ends. And so when a person is in haja, haram of the ends become permissible. When a community is facing haja, it is treated like a darura. And when somebody is facing haja and scholars differ on whether something is halal or haram, you take the easier one. These are rules of Sharia that it is important for those in the medical profession to understand, to study, because many of our ulama, many, not all, who come out from our Darul Ulum, who come out of our Markaz al-Islami and Islamic study centers, are not taught these areas. It's only if you're going to be a mufti and you're going to be handling real situations that you study these areas. And it is important that at least you are able to triangulate, that you know something about usul, you know the basics of qawaid, you know the basics of maqasid. To conclude, the need for you to appreciate your job is that of rahmah, of showing compassion, of taking people out of the difficulty and their difficulties. You need to do it with compassion. You need to be curious about all the fields relevant to your subject area. You need to do it with sincerity. You need to consult others. But ultimately, you will stand before Allah regarding how you handled your patient. Ibn Qayyim al-Jawziyah said, the whole of Sharia is about bringing benefit to humanity in this world and in the hereafter. In its entirety, Sharia is about achieving justice, compassion, wisdom, and benefit. In its entirety, it's about justice, mercy, or compassion, wisdom, and bringing benefit. He goes on to say, any ruling in Sharia that moves from justice to injustice, mercy to cruelty, wisdom to folly, or benefit to harm is a ruling that does not belong to the Sharia, even if somebody claims it's according to some interpretation. May Allah continue to guide us all. Jazakumullahu khairan, and thank you for your time. Assalamu alaikum.